All right, today we're going to talk about something we've all probably dealt with, the classic stomach bug, or gastroenteritis. We're going to dig into what the real danger is and talk about a surprisingly simple, life-saving solution that you can literally make in your own kitchen. Let's jump right in. So you know the feeling, right? That awful, queasy, upset stomach. But have you ever really stopped to think about what the actual medical danger is? It's probably not what you think, and honestly, understanding it is the key to treating it the right way. Okay, first things first, let's get on the same page about what we're actually dealing with here. How do you know for sure that it's gastroenteritis? Well, the signs are usually pretty unmistakable. Yeah, the classic signs are exactly what you'd imagine. You've got frequent vomiting and you've got loose stools. Now, in some cases, it can get a little more serious. Maybe you'll see some blood or mucus. And to top it all off, you might even be running a fever. It's really this combination that starts to quickly drain your body of everything it needs. And that right there brings us to the most important point. See, the vomiting and diarrhea, they aren't just unpleasant. They're the reason this gets dangerous. They cause your body to lose fluids at a really alarming rate, and that leads to the #1 complication of any stomach bug. And that condition is dehydration. It's a really simple concept when you think about it. You're just losing more fluid than you're taking in. But when your body is actively trying to get rid of everything, it becomes almost impossible to stay hydrated. And that's exactly when a common illness can turn into something genuinely serious. So, how do you actually monitor this at home? What's the one thing you should be looking for? It's urine output. That's your body's most direct signal about how hydrated it is. If someone, especially a little kid, isn't peeing much or at all, that is a huge red flag. It means their body is desperately trying to hold on to every single last drop of water. But here is the really good news. For most cases, the solution is incredibly simple and something pretty much everyone has access to. It's a first-line defense that has saved literally millions of lives around the world, and it's something you can do right from your own kitchen. What we're talking about is something called an oral rehydration solution, or ORS for short. And you're not going to believe this, but there is a dead simple recipe for making your own if you don't have those little pre-made packets handy. Okay, this recipe could not be easier. You start with 1 liter of clean boiled water. Then you add 6 level teaspoons of sugar. And finally, half a teaspoon of salt. Mix it all up really well, and that's it. You've just made a powerful tool to fight dehydration. And just so we're clear, this isn't some old folk remedy. This is completely medically sound. So why on earth does this simple mix work so well? Let's get into the science just for a second. The official ORS formula has very specific amounts of sodium chloride, that's just table salt, and dextrose, which is a type of sugar. Now, the sugar isn't just for a little bit of energy. It actually helps your intestines absorb the sodium, and the sodium, in turn, helps your body absorb the water. It's like this clever biological hack that makes hydration way more efficient than just drinking plain water. Now, of course, sometimes the at-home solution just isn't going to be enough, especially if someone is so sick they can't keep any fluids down at all. That's when it's absolutely time for medical professionals to step in with some more advanced treatments. So let's look at the different levels of care here. At home, our goal is oral rehydration therapy. That's using the RS powder or our simple sugar and salt solution. But in a hospital, if things are severe, they're going to move to intravenous or IV fluids. This method completely bypasses the digestive system and puts fluids right into the bloodstream. The goal is exactly the same, rehydration, but the delivery is just way faster and more direct. So, as we wrap this all up, it kind of leaves us with a pretty wild question. A major medical journal once called oral rehydration therapy potentially the most important medical advance of the 20th century. So, is it possible that this simple mixture of sugar, salt, and water is one of the most important medicines you've never really thought about? It's a pretty powerful reminder that sometimes the most effective solutions are also the simplest ones. Thanks for tuning in.